Okay, so once again, welcome everybody to this session. And as you know, that we were discussing about the healthcare analytics. Just to give you the brief, healthcare analytics combines this real-time data as well as the historical data. Why do we use the real-time data? We use the real-time data to know what is happening currently, and historical data is also helpful in understanding the uh, forecasting aspects of it. So it will also reveal the actionable insights and drive the medical advances. So one of the reasons why we have so many advances in the medical field is also because of the analytics. So you cannot discount the role of analytics as far as the medical research is concerned. So it also allows the healthcare organizations to improve the quality of patient care. See, the ultimate goal of any healthcare is also to give the patient care, right? How do you give the patient care? Maybe by reducing the medical cost. And how do you reduce the medical cost? You can reduce the medical cost once the advancement or research, or there are more you know investments that come in, and overall to achieve the long term goal. So from patient care we have to go to the well-being of the patient, and that's the idea. So healthcare analytics play an important role in it. The other one is the analytics also helps in hospital management. Hospital administration, hospital management is a big aspect as far as the running of a hospital is concerned. So hospital management involves too many variety of decisions, too many departments. All that boils down to data, and data analysis, data analytics will help in better administration of the hospital. That's one aspect. And then the patient engagement. See, the patient is already sick, he or she is undergoing the treatment. So how continuously you're able to engage the patient so that they are positively motivated. You have to send them hale and healthy back to their homes. That's the motto with which the patient engagement is actually going to work. uh, Nowadays, no treatment is done without diagnosis. Diagnosis is an integral part of the entire medical process today. So, diagnosis play an important role. Like, if you had tuberculosis in the past, uh, then that data is important. If you have diabetes, so that is also important to diagnose what is the cause of the disease. And through the causes you will also learn about the management, and then the cure, the symptoms, and then the precautions or the cure. So medical records are important records. uh, it's almost like you know you cannot lose the medical record of the patient. They form a rich value of the hospital. So these records will enable the patient care. And then you have to have some spending uh, in the hospital as far as these infrastructure things are concerned. So there are many more things. So if you overall look at it, it's the current and the historical data that the practitioners are going to look into in terms of providing patient care and patient engagement, hospital management, all that. Okay, let's move on and look at the importance of it. So analytics turns data into actionable insight. So it's not just you're sitting on the mines of data. I'll give you this example. So if Hyderabad has got some 2 lakh cameras, we have lots of surveillance cameras, the traffic cameras, and every street has some cameras. They are all installed by sometimes the administration, sometimes by the private people. So it's a big data. It's a huge data that you have. So what are you doing with that data? So are we reducing the traffic? Are we controlling the traffic? So if you look at the entire management of the traffic, you will come to know that during the peak hours, that is in the evening hours, the traffic is very high. The vehicular movement is quite high. It's terrible at times. So 5 o'clock to 7:30 or 5 o'clock to 8 o'clock, these 3 hours, the police really have to be on their feet. So data, you have it, and you have to use it. You have to make sure that the actionable insights are there, and that's how you will improve the quality of the patient care and lower the cost of it. Lowering the cost is not at the you know, risk of the patient care. They can go together. Patient care can happen at the same time. You can also lower the cost. That's why. And healthcare organizations have wealth of data. All the hospitals, organizations, firms, pharmaceutical companies, many of the whoever is involved in the healthcare organization, they have the wealth of data. They are sitting on the mine of data. So what are they going to do it? They are making their efforts to become more productive and insightful through the analytics. So that's why it's important. So tons and millions of data that you have, the data points you have, the data that is generated, you will be able to use them to understand it. That's how you have come to know that heart attack is the biggest cause of death. Cancer is the second largest disease that kills people. So the efficient use of analytics, including the data mining. Do you know anything about data mining? Anybody there? Or am I the one who's only speaking? Any idea about data mining? We did talk about it. Okay, so I'll do the talking if that is the case. So the data mining, if you look at it, the big data analytics, how are you going to pull out and extract the data, the big data analytics, and the big data example I gave you, that the metadata, the data of the data, and this will all going to assist in disease prediction. Uh, so epidemics and pandemics are difficult to predict, but during the epidemics and pandemics when it was happening, perhaps you can predict it. Like you must have seen during the early first wave of COVID-19, coronavirus. So they were saying that half of the world will get it. That is the way that pandemics actually work. That is how things will be. So they predicted the disease through the analysis, through the analytics. So you can also predict the diseases, you can diagnose the disease, you can start the treatment and cure. And then you can also reduce the fraud reduction, the frauds. The number of frauds in the healthcare are also going up. There are also ethical issues into it. So the medical ethics usually tries to look into how and why they are going to, you know, look after the fraudulent activities that are taking place. Sometimes by the uh, you know attendants and the patients, sometimes by the medical fraternity also. So that's one area that you have to look into it. Then the healthcare analyst face the challenge of translating the large volumes of structured and unstructured data into knowledge. That means you have the volumes of data. You're sitting on this mine of data, the wealth of data. Sometimes it is structured. You won't get it in Excel. Sometimes you get it in PDF. It's very difficult to convert it, or even if you have an app to convert that data. Sometimes the way that you wanted to do it, the rows and columns are not in the great sync. So it's also unstructured data. So that structured and unstructured data, you have to bring it down, boil it down to the knowledge. And that knowledge is going to help you in healthcare efficiency and reducing, again, lowering the cost of the medical treatment. So, time and again, if you look at it, the importance of healthcare analytics is telling us patient care and reduction in the cost. Cost is a major issue because people may not go for treatment if the costs are high. If the Because the affordability of the treatment is also an issue, isn't it? Even they are accessible, but if they don't have money, it's very difficult. People mortgage their houses, people mortgage their properties, people sell their properties, and then come back for the well-being and for the health of the patient. So it's prioritizing it. So if the cost reduction can probably, yeah, somebody is joining, I'll just admit it. So we were discussing about these things. Okay. So let me just quickly once again go back to the PPT that I was sharing it. So overall, if you look at it, the message is loud and clear that data analytics, as far as healthcare analytics is concerned, it is the efficiency, bringing transparency, bringing some kind of accountability into the healthcare industry, and also trying to get they're trying to have uh, you know the efficiency and then reducing the cost. That's what we said. Okay, moving on. So what are the different kinds of health benefits that you have? So you will have lots of healthcare benefits. One is, of course, one is that it's going to lead you to a better organizational planning and administration management. There are also better insights that lead to improved healthcare services. So, like chemotherapy, if you look at it, chemotherapy in the 90s or in 2000 versus in 2020, there is a difference. So, how do you think that this improvement has happened? In almost all the spheres of the medical knowledge that you see, there is a healthcare improvement. That healthcare improvement is also because of the data analytics of the healthcare. And there is also this increased provider access to patient data that will enable them more holistic and safer care. Uh, so whoever is providing access to the patient data will have a whole idea, a larger perspective, and this data is not being sold. This data is for precious purpose, like WHO is having that data, or sometimes the government of India is maintaining its own databases. So sometimes the data is also publicly available, like the data that you get it from the National Medical Council. It gives you safer care as far as the patients are concerned. Moving on, so identifying trends and patterns helps in root causes of it, uh, analysis and so on. Just a minute, somebody is calling me, so I'll just take this call. 1 minute. All right, so guys and girls, we were discussing about this very important aspect of the benefits in the healthcare analytics. Then you have the population health management. These are the micro perspective that you get from the data. One is the outcome driven data, the health determinants. So what determines the health, and what are the interventions at the right place that you need it. Sometimes you suddenly see there is a rise of malaria cases in the population in the city in some places due to mosquitoes. Sometimes you also have this chikungunya. We had a lot of cases where chikungunya patients were suffering. There were body aches, body pain. So how do you intervene? I mean, is there a vaccination available? Is there a medicine? Is there prevention? Is there treatment? And how do you also devise and design and develop policies for it? So those details are quite important to know about it. So if you look at personalizing patient outreach and treatment also enhances the engagement and follow through. Every patient is unique. So you cannot, have the same stroke for all the people. So different folk, different strokes. That's the primary idea behind any kind of healthcare. So the more that you know about the patient, the better that is going to help you in understanding the patient care. Patient care and the cost, these are the two terms that you will generally come across. So please do keep that in mind when you are thinking about data analytics as such. Okay, uh, let's move on and then we will try and look into uh, the other part like the predictive analytics. So there are, forecasting predictive analytics is also for the future conditions. Uh, do you think with the advent of AI, let me write it in the chat box and please do respond. Uh, I know your mics are off, but you can unmute the mic or probably you can also see the chat board. Do you think, that AI will disrupt the healthcare management? That means there will be lesser doctors and paramedics, uh, paramedics in the healthcare. What do you think? So, what do you think, guys? Uh, we have Nivedita, we have Santosh, we also have Monica. Anything in particular that strikes you? Please feel free. I have put something in the chat box. Would you like to respond to that? Any one of you? Hello.
Sir, good evening, sir.
Yes, good evening. Go ahead, please. Am I audible to you?
Yes, sir. Yes, sir.
Yes. Okay,
Sir,
great.
uh, while interaction with the patient, AI
Yeah.
also should know the past history of the patient, whatever the complications he's suffering from.
Yeah.
Then only it can give us a proper medication for that particular disease.
Mm-hmm.
Only when a patient interacts directly with the doctor, doctor comes to know what is the previous condition of the patient, what is the medication he is currently taking, and what is the dosage also. But
Yes.
AI doesn't see all these things, no sir. So
Yeah. So
it might create some problem while predicting any kind of medication to the patient through AI.
okay, fair enough. Point well taken. Thank you, Santosh, for this nice intervention and deliberation. But these are the infantry or the initial stages of the AI. Probably, if you have given the right insights or right inputs over a period of time, there is also with the machine learning and the blockchain technology that you're going to install into it, it might be helpful as well. Yes. Right now, today, the customization, as Santosh is talking about, the customization, every patient is unique, he said, and hence their patient care or their care management is going to take a different route. Agreed. But over a period of time, even that customization, right now, the whole lot of standardization is happening in AI. And with standardization in a healthcare industry, it's not going to be workable. Only in pandemics, only in some cases, it might be where everybody has got the same disease. Even if everybody has got the same disease, they might have the history of different other diseases also. So if I got COVID and I was also diabetic, then those details are also to be inserted. It's a very, very complex, large language model that you need to incorporate. Yes, so that's where the predictive analytics is the future for the organization. Many hospitals, many healthcare firms and organizations, they are investing heavily into it. It's a big money now of the predictive analytics. because they wanted to know that it's not just today, it's not just current, it's not just latest number of patients or things, but they also wanted to know what does the future look like. How many more people will become diabetic in the next 5 years? How many more people will suffer with obesity? How many people will also suffer with sedentary lifestyle habits, if not diseases? So accordingly, they will be able to launch their medicine programs, and sometimes you also need to have devices. So the whole diagnostic industry plus the pharmaceutical industry plus the doctors fraternity and then the paramedics, the support staff, everybody is now going to uh, make a deal out of this. So the other way is to look at the tracking provider performance that will improve the quality and the efficiency. uh, One is that somebody is admitted into the hospital and they are discharged. But after that, what? If they go back home, do you have any kind of access to the patient? What kind of access that you have? Only when the patient comes to you. But do you have access to the patient? How do you also improve the quality and efficiency when the patient is discharged but still having disease or still having some symptoms, not fully recovered, but on the verge of recovery or in the process of the recovery? So, how are you going to take care of him or her? And that tracking system would enable you to do so. So, this is going a long way. So, in the premises, on the campus, the patient is there and he or she is taken care of. But after they go back, and when they do not report, in many cases that many people after discharge they don't report. In some cases, yes, they do. So, but can the data analytics in the healthcare would allow you to track it, and then also tracking waste in the system. There are a lot of pilferages. There are also a lot of leakages. There are also a lot of wastages that can happen. Unnecessary wastages can happen. So not just the disposable items, but in many cases the electricity, the consumption that is happening. So the hospital bills that are there. So if the hospital bills are swelling, it's a 12 lakh to 30 lakh rupees, just the electricity bill if they are paying off every month, and the footfall of the patient is low, it's not a sustainable model. So how do you also track the usage of the infrastructure in terms of the reduction of duplication of services? So you have ordered, let us say, few of the gloves, few of the masks, which are already there. So, but if you have the entire supply chain data with you, and you also know the requirement, the future requirement. I mean, you want to be on the safer side, but also at the same time, you don't really want to bulge yourself and swell yourself with, uh, you know, duplication, triplication, plenty of articles. And at the same time, there's also a problem with the space. Where are you going to keep it? That's where there is also this thing called, in operations management, you must have learned it. It's called the bullwhip effect. It's a very famous statement, effect called the bullwhip effect. So the supply chain partners are not in line, and hence that leads to bullwhip effect. I don't need so many surgical masks. I don't need so. It happened in COVID also. Suddenly there was a shortage, and suddenly there was also this over production of it. So whole manufacturing efficiency can also lead to some kind of, you can say, inefficiencies, inefficiencies of the things. You need to get it on timely basis, and timely basis means you need to have the account of it. Plus and minuses 5-10% here and there, fair enough. But before that you have to have a count. Like in a wedding, how do you know how many people are coming to your wedding? Any idea? How do you cook the food for the people? How
Card
do you
distribution, sir.
how do you take a head count?
Card distribution.
Yes, card distribution is one. Oh, yes, because you get how many cards you have printed, how many you have distributed. You know for sure the close relatives are surely going to come. You have a count. You also use the RSVP, right? You feel like, okay, please do come. We are eagerly waiting. And over and above, if you have invited 500 people, so approximately you will have, 10% extra in most of the cases. But what happens if 20% comes? There is a problem. What happens if they are less than people who have come? So less than 400 people come. So there is a food for 600, but people attended are 400. So there is a enormous amount of it. So in either case, it's a wastage. And that's what in the medical field also you like to reduce the wastages, because every wastage is again going to transfer to the patient. Nobody is going to take the cost. Have you seen in the insurance? I don't know how many of you read the insurance policies or use the insurances. Uh, God forbid that you fall sick and go to a hospital and then get your treatment in the hospital using insurance. In the insurance, when the final bill comes, they put everything, almost all. It's not just the treatment, it's about the disposable items as well, the mask, the food, everything, and they're pretty costly, costlier than the market price, because the hospital is going to make money out of it, and that's how a health insurance is becoming costly. The premiums are going up. In after Corona, after 2021, the premiums are really high. It's exaggerated. It has been exorbitant, and that is the concern. Healthcare analytics, on the other hand, trying to get the details of it and reduce the wastage. That's the system. Okay, let's move on. So, healthcare analytics benefits, yes, there are plenty of them. One is to understand the performance, the benchmarking. This is the bare minimum thing that you should be able to have the standards. Performance measurement in terms of the diagnostic, in terms of the treatment, and also in terms of the staff. When I say staff, it includes the paramedics and also the on the ground staff and all of them. So you will continue to have them, right? And improve the quality, like clinical quality improvement, clinical decisions support. You have to sometimes take a quick decision, not just always emergency situations, but also in cases where you are supposed to suddenly there is a breathing problem. Are you going to provide this uh, oxygen support? How do you address that problem? And the more you're going to delay the time, and it is going to affect you, right? That's where. And the patient engagement, how wonderfully and how efficiently you're able to engage with the patient. Patient engagement is the key to patient care. Patient engagement. What is engagement? You heard this term engagement? Patient engagement leads to patient care, and that in turn will lead to your well-being overall, if you look at it. So that's one. Then the advanced research that you are seeing, because no subject is static today, isn't it? Analytics as a field is dynamic. It's quite dynamic in nature. So the clinical research that you see, the development that you see in the clinical research, the registry-based clinical trials, a lot of trials are being conducted. Uh, so these trials are largely run through the funding and also through the research support. So research is funded, research is experimented, trials, and post-market surveillance also. I mean, what has happened? So you have vaccination. If you look at the whole history of vaccination, right from chicken pox, smallpox, so hepatitis B, right now you have of the coronavirus vaccination, different kinds of vaccination. So these are all have come because of the clinical trials. You need to have at least 9 months. You need to have right sample. The size of the sample is also going to matter. The representation of the sample of the population, all these are very crucial, uh, these stages into it. That's how you will be able to manage the risk and then report. So the decision making, clinical risk management, financial risk, because who's going to bear that? If there money that is involved, not always the government is going to take that financial risk. What happens if you have a 500 bed hospital and the beds are not lying vacant? So there is a high maintenance cost. So 700 bed hospital and there is a greater risk. So who has to value that? I mean, when this question was asked in the newspaper to many of the medical, directors or minister, health minister, the same thing they replied it, the financial risk management. When the value is not there, how many are the beneficiaries of the Arogya Shri? If the government of India has declared that all the farmers are going to get even the health insurance, especially some of the industries like mining and places like where there are nuclear power plants, farmers are supposed to get it. So those reimbursement programs, even if they are unorganized sector, unorganized sector is worst for people, especially they may not be able to get the right kind of benefits. And then the regulatory part and the reporting. Okay, let's move on. So the role of analytics is always there to transform the healthcare from stage A to stage this transformation. This transformation that you can see visibly, you can get that. And this is the way it's done through IT, information communication technology or informatics technology. And you will be able to get the insights. And healthcare organizations also try to leverage administrative and clinical information for increased efficiency and improved clinical outcomes. Yes, I mean, that's another transformation. If you look at the surveillance and the preventive management, prevention is better than cure. Why do they say that? Because you have information. I know that it is going to come, hence I'm avoiding it. I know that the pandemic is here, I'm not stepping out. I will try as much as possible to be here. That's what it is. So analyzing the disease pattern, like tracking the outbreaks, we have done that, right? You have been witness to that in the recent times. In last 2 3 years, you are able to see those emergency situations also, and you have to quickly respond to it. Otherwise, there will be more casualties. The government will be blamed, and sometimes the government might fall. Even the people will lose trust. So it's a very, very highly emergency situation. And developing targeted preventive techniques and vaccinations. All these vaccinations are also to prevent so that it doesn't affect or attack, or you're not attacked by the disease. Then providing the prompt care to the affected population and to prevent the crisis and reduce the morbidity. This word morbidity and mortality, we have often heard it during the pandemic times. People who have died in the COVID, how many people, what is the size of the population, what is the percentage of people who have died in COVID? And you come to know that the mortality rate was high because of the patient's morbidity that they were. They were already suffering with something, hence, as a result of that, this virus has badly impacted them, causing the death of it. What about the diagnostic and therapeutic techniques? Plenty of diagnostic and therapeutic techniques are available. Healthcare analytics is surely going to bring people together. Look at it. With one click, you will be able to have the clinical information, financial information, operational data that you know, and then you will evaluate the process. So, different modules will help you to know about it. You are quite curious. The government of India, the government of Telangana is very particular about eradicating polio. So, but do they have rich pockets, deep pockets, financials? They may not. So, you should be able to have not just clinical expertise and efficiency, but also sound financial pockets or systems, and then the operational data that will improve the efficiency. Patient status, I joined as a cancer patient, and I was at the stage 3, and there is a hope. There is very little grim hope. That hope you should be able to develop, and this patient status from almost negativity to slowly entering into zero, and then significantly improving to the positive side of it. So areas where healthcare providers benefit from the healthcare informatics and predictive analytics. One is identifying the consumers at high risk and developing targeted wellness program. So who are the consumers who are at high risk? I think that's a very important part. The predictive analytics will look into the risk factors also. And then they will be able to help you to have the wellness program designed based on that, customization done on that. So, identifying ineffective programs. So, programs which have failed. Uh, Tell me some of the programs which have failed in the recent past, which didn't work as far as the healthcare industry is concerned. There is this programs called DOTS treatment. Anybody heard of this DOTS treatment? It's given in mostly in
TB, sir.
tuberculosis, TB. Yeah. So 9 months program that you had has been fantastically, phenomenally great. So in the last 30-35 years that you have, the respective state government, the central government, and it's a collaborative program, and lots of other NGOs and all of them, they were able to eradicate. We have come to a point where we will be saying, although it's the biggest killer, or one of the biggest killer, no doubt about it, eradication program. You should be able to eradicate it. It should become like history, thing of the past. How do you do that is a question. That's where you will be able to have that, right? And then ineffective programs which was not effective at all, and so on. There was this uh, with pinch of salt. You have to take my statement, and you are most welcome also to correct me, because I sat in many of the debates of the healthcare professionals, and I saw both the ends of it. Hepatitis B. Is there anybody in this class who has taken a hepatitis B vaccination? How
Yes, sir.
many? How many are there in a million who are affected, impacted by hepatitis B? Any idea, anybody, or any thoughts? But you heard a lot about this thing. So that's where the programs are not helping, like the malnourishment, nutrition. uh, did you read today's newspaper? There is this town called Bhuvanagiri near Yadadri district, I think, or Bhungi district, Yadadri town. There were quite a few of the children got food poison, and one of the child died, a young boy who died. His father happens to be a driver, and they end up paying 3.8 lakh rupees, and still they died. Still, they were not able to save this boy. The boy died. That was really tragic. And stale food is the cause, they say, but how many people have survived the stale food? That data. So because it was Ugadi, they were coming from homes, they were carrying food in their tiffin boxes. It could be the stale food. It could be the weather, because the weather has become so prickly heat. It's a problematic weather. Those things. So programs that has also failed. Look at this one, the application of data mining in healthcare. Somebody trying to join at this point. Let me just admit Monica. Okay, people are okay. Look at this chart that you have. This is looks like an organizational chart. I was telling you about different types of analytics that we have. First, look at the application of data mining in healthcare. You can divide into two: analytics and theoretical, study. Theoretical study is not that really too many branches are not there. Largely dealt by the theoreticians. But if you look at downstairs, the spelling of yeah, look at the types of analytics that you have in analytics. These are the three types of analytics that you have: descriptive, predictive, and prescriptive. Prescription. So which one is powerful among the three? Your thoughts, please. Which one?
Naturally, prescription.
Prescriptive. Why?
Yeah.
Why not predictive? Why not predictive? As I see organizations which are futuristic in nature, futuristic, they will have predictive. So let's go through each one of them, and we will discuss in detail in our subsequent classes. But let me just try and run through this uh, important points that you have. And what is the type of data that you get it? So one is you can get a lot of data through the social media as well. Social media data is quite good. Sensor data that you may get it. You also get biometric data. So biometric data, how many times you have punched in, punched out, how many people have gone inside, outside, operation theater, this, that, blah, 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 blah. What are you going to do with that data? So you can also understand how engaged they are, how many times they have taken breaks, how many times they have went out, how many times they have visited cafeteria, how many surgeries that you have performed. So those data, or were you absent? It also gives you the absenteeism data as well. It's the attendance data of the biometrics, right? The big transaction data that you had it, and the human generated data where you collect it, maybe at the reception, maybe once you get admitted, you will ask them to fill some forms, you or orally tell them some of these things, questions. The entire questionnaire is filled by the human generated way. The other one, the data mining, is like regression in so data analytics is all about statistics in some sense. So if you know a little bit of statistics, then you will love analytics. Like regression, one variable is being regressed to the other variable to find out the causal relationship, cause and effect relationship. The other one is the association relationship, how X and Y. What? So how Y is impacted by X, right? How is lower income affecting or impacting health? Why lower income? is going to be a problem in a society as far as health is concerned, because you would not buy essential commodities if your income is low. You will not have nutrients, you will have malnourishment, you will have diseases which are related to nutrients. You're not consuming enough nutrients. That's how you will see the suffrage, the suffering of the poor. The poor will suffer in a different state. That state is because they have no capacity to buy the commodities which can give them the nutrients. That's one. That's where. The other one is how X and Y are related. X and Y, how are they related to each other? X and Y. There is no causal relationship. This is largely about how they are associated. How X and Y are associated. What is the relationship between anything that you have? Middle income group and the disease management. Nothing is causing or nothing is impacting. There is no cause and effect. Cause and effect is not there. Is not there. But there is a relationship. So that relationship we are referring here. Okay. So that's fair. So there are a lot of ways that you can also classify clustering around the population. And so you will also bring cluster means getting the data into blocks. We have population clusters. We divide the population into lower, middle, upper income, right? These are the clusters that we formed. We can also form clusters of through gender, male and female. So who will suffer a lot as far as the cancer is concerned? The female that we have seen last time at the WHO site, right? We will revisit it later. So those anomalies detection. Are there any anomalies that are there? Anomalies are the problems that you have. And data warehousing. Where are you going to store the data? Do you have servers? What kind of servers do you have? Do you have the firewalls? How do you protect the data so that it is not being uh, hacked, and then it is also not being attacked by the virus? Then the sequential pattern data mining and so on. So the application, if you look at it, this is of our great interest among all the things. So uh, you have the types of analytics, you have the types of the data, you also have the techniques, but this is of concern to many. The top management is interested into it. The data scientists or probably the statisticians, analysts would be interested in the data from here, and this one as well. They would be right. So uh, middle level managers would be interested here, or operational guys would be interested into it. But the same data, when it is being presented, it will be of application. It has implications. What sorts of implications? How are you going to support the clinical decisions? Should we go for operation or should we do it through the medicine? How do you take that decision? That decision comes because of the data. You look at the diagnostic reports, you have look at the historical data in the past, what has happened, you refer to some of the case studies, and then you take a clinical support decision. Healthcare administration, the day-to-day healthcare administration, right from admitting the patient to also looking after the management of the patient. So there is also a lot of documentation that happens with insurance, without insurance. There are plenty of things that are there, and everyday administration that can happen at the patient level, at the administrative level, and at the government level also. So you also have to sometimes upload some of the records to the government website, and maybe the NMC, the National Medical Council, makes it mandatory that you should be able to give that data, especially with the children's birth. So you're going to issue a certificate Based on this certificate, the birth certificate issued by the municipal corporation. So the GHMC is going to give you. So all that is part of the administration. And what about the privacy and fraud detection? You may be leaking the data to your counterparts, or probably you are trying to infringe it, or there can be fraud also. I mean, people can, you know, hack your financial payment system, the payment gateways. That can be there. So, what about the mental health, which is not spoken much about it? So, the application will be, so what will happen to the, what is the state of mind? Have you been to, there is this place called, uh, what is the name of this place? It's near Gachibowli, no? I'll tell you over a period of time. So there is this nice, cancer hospital. Uh, have you been to any cancer hospital, and where most of the patients are suffering with great pain? And what will be their mental state? How will you deal with them? What is the impact on their mental health? They are suffering with physical ailment, but they have blocks. Their mind stop thinking positively. They always see negativity, pessimism. They are withdrawn from the world, and sometimes they may get into depression also, the suicidal tendencies. So mental health is a big deal there, because of lots of other variables impacting you, right? Okay, somebody is trying to join here. Yeah, Veerappa is here. Okay, good. Better late than never, as they say. So that's one. And then what is public health? What is public health? Public health is a subject that requires a lot of attention. I mean, it's also taught to many people in the medical colleges about public health, and where public at large will be taken into consideration as far as the health is concerned. It is the state's responsibility to provide healthcare facilities, benefits, services to the large number of masses. And then the pharmacovigilance. Vigilance is another thing, because pharmacology, pharmacovigilance, these are the terms that are being used to have a clear idea and understanding of the vigilance as far as the pharmaceutical companies are concerned. So it gives a great, overview about how you're going to apply the data mining in the healthcare and so on. So I was telling you the different types of the healthcare data analytics. Let's go quickly and try to look at them. So healthcare analytics involving right from operational to strategic. Operational middle level managers, or the entry level managers, or the ground staff and others. Whereas strategic levels are done by the proprietors, or the top level managers, or the executives. Uh, so, and from descriptive to more sophisticated, descriptive much easier, right? So for the future, they use predictive and prescriptive analytics. So somebody said naturally it is a prescriptive analytics, and after that she kept quiet. So I was really interested to know why, and here the answer lies. The answer is here because both predictive and prescriptive analysis will be utilized for decision making, because the kind of prescription that you're giving is based on the decision. So that decision is important. So there are four types of healthcare health analytics: descriptive, diagnostic. In some textbook, you may find it only three, which is also okay. The diagnostic part is missing, but nevertheless, these four are there: descriptive, diagnostic, predictive, and prescriptive. So let us look at the example of each one of them. Descriptive analytics. What do? You will try to determine the contagiousness of a virus by analyzing positive test rates over time. So positive tested, how many uh, positive cases are reported every day? The, I think, gastroenterology department, and then the Ministry of Health with the help of gastroenterology department collecting the data and publishing it. Have you seen? Even in the newspaper, they were printing it. Do you remember? Recall that there used to be a column in almost all newspaper. How many cases, state-wise, district-wise, uh, city-wise, positive, and then you can even get that. The last time also we visited that site, and it tells you that how many active cases are there. That's a very descriptive analytics data. The other one is the diagnostic analytics. Look at the diagnostic analysis. So diagnosing a patient based on their symptoms. So I don't have virus, but the symptoms are telling me I have cough, cold, and then fever, and the fever is not coming down. So based on the diagnosis, you are telling that, or you are saying this data point, this record needs medical attention. The third one is the predictive analytics. Predictive analytics based on the forecasting part of it. So how the spread of the seasonal disease based on the previous data. So come monsoon, what are the diseases that you get in the monsoon in Hyderabad? What are the common diseases? Anybody?
Malaria.
Yeah.
Malaria, dengue.
Malaria, dengue, yes. Dengue is one, malaria is one, undoubtedly. So based on the previous data, you are ensuring whether you have the bandwidth, whether you have the facilities or infrastructure. So is the quarantine hospital at Fever Hospital near uh, Tilak Nagar, right? Is it sufficient? Are you capable of handling these cases? What kind of arrangements that you have made? So come monsoons and people fall sick. So many people fall sick because there is a change in the weather cycle. Water, contamination of the water, stagnation of the water will lead to the propagation of the bacteria, mosquitoes, and hence leading to malaria. A cause of death, malaria can kill people if it is not being properly, administered or taken care. So that's where the predictive analytics. So historical data is helping you to predict the future data. So 2023 number of malaria cases in the vicinity of GHMC, 150 wards, you had at least 3 lakh people falling sick, and that is the onset of the monsoon. From June, say third week till July third week, in 1 month you had 3 lakh people, and that data is essential for 2024 monsoon. And the meteorological department, that means the Indian Meteorological Department, IMD, has predicted that it's going to be normal or above normal monsoon. So you can expect the rains are going to be during that time. You will continue to have that. So you have to create facilities. So predictive analytics, always, as the name says, prediction. Prediction means future forecasting. The last one is prescriptive, assessing patient's risk factor. What is to be done, what cannot be done. So if a patient is 80-year-old, can he withstand any kind of spinal surgery? These are patient related, individual related things. And this is totally a customized thing. Assessing the patient's risk factor and implementing specific preventive treatment plan. What is prescribed to you? And everybody talks about stents today, right? They said, okay, we have the stents and we have problems, and then why don't you have stents, or why don't you go for bypass surgery? But bypass surgery, you should be eligible to it. It is based on the patient's complex. This is not uh, universally applied. It differs from individual patient to individual patient. That's where it is. So these are the 4 important things. Keep that in mind, and we will end it here.